And we are here today to highlight the work that the state of New Jersey is initiating around a very important issue. Maternal and infant mortality and morbidity remains at the forefront of public health initiatives nationally and in New Jersey. Although this topic has had a long-standing prominence in the public health arena, attention is needed as pregnancy-related challenges, along with persistent inequity and mortality rates for women of color, continue to persist. Through the leadership of First Lady Tammy Murphy, support from the Commission and the New Jersey Economic Development Authority, today you will hear about the Nurture NJ Maternal and Infant Health Strategic Plan and the announcement of CSIT Seed Grant Awards aimed to support early-stage innovation companies addressing maternal and infant health challenges. We are honored to be joined by a dynamic lineup of amazing speakers: First Lady Tammy Murphy, Tim Sullivan, CEO of NJEDA, Judith Sheft, Executive Director of the Commission on Science, Innovation, and Technology, and two amazing New Jersey-based startups. One company developing a dynamic software platform that provides mothers with direct access to culturally competent and sensitive physicians throughout the state, and another company developing groundbreaking therapeutics that addresses early detection of infections that causes pregnancy loss and birth defects. Really amazing work by our companies. The Commission on Science, Innovation, and Technology recently launched the Maternal and Infant Health Grant Program to support companies that are developing technology, therapeutics, and other solutions to address maternal and infant health challenges in New Jersey. The grant accelerates research and development and transforms new discoveries from research stage into commercially viable products and services. I am very happy to announce that this morning the CSIT board approved 17 grants of up to $75,000 to 17 early-stage STEM companies, totaling over $1.2 million. I'm also happy to announce, to their surprise, that these companies receiving the awards have joined us today and are in the audience. So congratulations. We look forward to all of your great work and contribution. I would now like to invite up an amazing woman, mother, and leader, New Jersey's First Lady, Tammy Murphy.
Okay, good afternoon, everyone. Thank you, Maku, for that. I am grateful for the introduction as well as your leadership here, which is pretty amazing. I also want to recognize Assemblyman Danielson, who I think is supposed to be here. I'm not sure if he isn't here. He's here in spirit, I know. So Assemblyman Danielson, CSIT Executive Director Judith Sheft, CSIT Chair Debbie Hart, and CEO of the New Jersey Economic Development Authority, Tim Sullivan. It is an honor and a pleasure to be with all of you here today and to recognize the Maternal and Infant Health Grant Program awardees. I want to thank everyone at the Commission on Science, Innovation, and Technology and the New Jersey Economic Development Authority for their support of these outstanding innovators and, of course, for their essential partnership to Nurture NJ. This Monday, on the 23rd of this month, we will mark our 6th annual Maternal Health Awareness Day here in New Jersey. In that time, we have made some really significant strides. Our very first effort, our ongoing community-wide family festivals, has now brought state, county, and local resources to over 6,500 families. And on the legislative level, my husband, Governor Murphy, has signed 43 pieces of maternal and infant health legislation, including some of the most groundbreaking and revolutionary maternal health policies in the nation. These groundbreaking policies include establishing the first and the most robust in the nation newborn nurse home visitation program, Medicaid coverage for doula care, which we were the third in the nation to achieve, and the first to fund community doulas. Furthermore, we were just the second state in the nation to expand Medicaid coverage for 365 days postpartum. And while every step that we take and every aspect of our Nurture NJ maternal and infant health strategic plan is an essential part of our strategy to solve New Jersey's maternal health crisis, there is perhaps no field more promising than research and innovation. That is why one of my top priorities for the next 3 years is to ensure our Maternal and Infant Health Innovation Center in Trenton is not only built but thriving. Ooh, got some good positive feedback on that one. This center will continue our collective work well past the Murphy administration. It will be an incubator for research and development, an academic and perinatal workforce training center, and a data collaborative, and just so much more. We also plan to include comprehensive clinical services in the center to serve moms before, during, and after pregnancy. This one-of-a-kind center will not only help us transform the maternal and infant health landscape here in New Jersey, but it will make our state the national model and gold standard for maternal care. And after reading about the work of today's grant recipients, it is clear that all of you will be essential partners in reaching that goal. Where one group is working on novel therapies to eliminate the virus that causes the most birth defects in the United States, another is developing a lotion to fight morning sickness, and another is creating next-level formula. These are really revolutionary ideas, and I am beyond proud that they're originating here in New Jersey. And by the way, those are just a few of the projects receiving grants today. Others are developing an easier method of obtaining blood samples using state-of-the-art technology to treat postpartum mood disorders, and designing pacifiers that are able to properly dose medicine to an infant. I say this to every grant recipient here today. I am literally blown away by your creativity and your genius. Thank you. I obviously do not have a background in science, but I am a mother of 4, and I know firsthand what a difference projects like these will make in the lives of mothers across the state, and ultimately, perhaps our nation and beyond. Pregnancy, even in the best of circumstances, can be a challenging and uncomfortable time. The testing is endless, as are the fears that truly at any given moment, something really could go wrong. Many mothers have debilitating nausea or other complications. Additionally, there is the challenge of finding the right healthcare provider, the right community of support, the right brand of formula, and on and on. Your projects truly have the power to address each of these concerns, save lives, ease discomfort, and make significant medical advancements. And more than that, it's obvious that every single awardee receiving a grant has led their work not only with innovation and talent, but also with empathy and understanding of the specific needs of mothers. And that, at the end of the day, is the core of our work. I am beyond impressed and really just so very grateful to know and now count each and every one of you as a partner to Nurture NJ. With our center and your projects transforming the landscape of maternal and infant health, we will make New Jersey the safest and most equitable state in the nation to deliver and raise a baby. I'd like to say congratulations again to all of you. I really can't wait to see what comes next. And it is now my honor to introduce a dear friend and great leader of the Economic Development Authority, CEO Tim Sullivan.
Thank you, First Lady, for that very kind introduction and for being here and for making this all possible with your leadership and energy around this vital topic. Welcome to the New Jersey Bioscience Center, by the way. This is an EDA facility that we own and operate and have for a number of years, and a number of companies in this building and a couple of the buildings on campus call this home and have grown into great big companies from small seeds. which is exactly what we're talking about at these grants as well, these maternal and infant health focused innovation grants, seeding the next generation of companies that are going to find the cure, that are going to make the difference, that are going to bring the innovations to the marketplace that will solve this unacceptable and enduring health crisis that we're facing in maternal and infant health. This announcement, this program, this initiative really brings together two centerpieces of Governor Murphy and First Lady Murphy's strategy overall. One, as the First Lady just said, making New Jersey the safest and most equitable place to have and raise a baby. And two, recapturing New Jersey's leadership position in innovation and entrepreneurship. And those two goals come together here because who better than New Jersey? We are the medicine chest of the world. We were Silicon Valley before there was a Silicon Valley. Who better than New Jersey? Who's better positioned than us to bring the power of innovation and science and research and discovery and higher ed to this horrible challenge of maternal and infant health, particularly the disparity that exists between moms of color and white moms in our great state. We think that the Maternal Health Center, Innovation Center that the First Lady described in Trenton is going to be a game changer. The companies that are applicants for and now awardees under this grant program are exactly the kinds of companies we hope will call that space home. So that, yes, they will develop the technology and develop the companies and create a bunch of jobs along the way, by the way, in our great city, capital city of Trenton, just down the road in Route 1, and also address the persistent challenges that moms and babies are facing right now. So it's both the center that the First Lady has identified $45 million of funding for, or 20 million of state funding and $25 million of federal funding that we've applied for and have in our sights to build this center. And we're going to be launching a process in the first quarter of this year to identify formally who our partners are going to be. So if you're interested in being a partner, perk your ears up. Get ready. Your homework assignment is coming. That'll be an RFQ. If you speak procurement, there'll be an RFQ coming your way in the first quarter of this year to begin the process of identifying who the partners are going to be as we build this center. But a vital piece of this, as the First Lady said, there's going to be clinical services, there's going to be higher education and perinatal workforce development, and then also innovation and incubation space for companies doing exactly what our grant recipients today are focused on, because we know that there's both an urgent need from a public health and a human suffering perspective. There's also a huge economic opportunity that comes with solving this crisis. This is going to create companies big and small. They're going to create a lot of jobs, create a lot of prosperity, and do it in our capital city, which needs the shot in the arm a lot. And so again, this program, this award, this set of grants that are going to be made today, I think is part and parcel of two really important themes. And it's also worth noting, as I hand it over to Judith in a moment here, Governor Murphy in the summer of 2018 signed legislation bringing back the Commission on, or creating, sort of bringing back, they added the word innovation, creating the Commission on Science, Innovation, and Technology in this very room. Right over there. The room was oriented the other way. I remember it very much because the sun was in our eyes, which is why we're doing it this way today. But it was in this very room the governor signed that bill bringing back the commission, and it was because we wanted to do things just like this program and lots of the other programs that I'm sure Judith and her team will talk about in a moment, because innovation, we think, is the essential ingredient to durable job creation. Companies of today that no one's ever heard of turning into the great big success stories in the Fortune 500 companies of tomorrow. New Jersey wrote the book on that in the middle part of the 20th century, and we are bringing it back in a big way under Governor Murphy and First Lady Murphy's leadership. So congratulations to all the winners. Judith, you and your team, great job on this great program, and we're excited to make progress here. Because there's a hell of a lot more progress that's needed. So with that, CSIT Executive Director Judith Sheft.
Thank you. I'm Judith Sheft, Executive Director of the New Jersey Commission on Science, Innovation, and Technology. The Commission is proud to work with First Lady Murphy and our partners around the state to support the crucial and life-saving work being done through the Nurture NJ initiative. Helping these startups advance their products and services from ideas through commercialization will have a lasting impact on the quality of care for New Jersey's mothers and infants. CSIT is responsible for strengthening the innovation economy within New Jersey, encouraging collaboration and connectivity between industry, academia, and the translation of innovation into successful, high-growth businesses. We are committed to creating and advancing the state's innovation ecosystem, creating a stronger and fairer economy for all New Jerseyans by keeping our state at the forefront of scientific and technological advances. CSIT programs are designed to amplify and accelerate positive commercialization outcomes. We create linkages to enable entrepreneurs to successfully access critical federal resources and provide connections to capabilities at our New Jersey academic and nonprofit institutions. Diversity, equity, and inclusion is a key foundation as we strive to ensure that New Jersey's innovation ecosystem is the most diverse in the nation, increasing participation by women, underrepresented minorities, veterans, and LGBTQ+ innovators. Through the Maternal and Infant Healthcare R&D grant, companies will accelerate R&D discoveries into commercially viable products and services, moving these life-saving products from bench to bedside. Applications include innovations in digital technology, therapeutics, diagnostics, and devices, all aimed to improve health outcomes and engage touch points throughout the entire healthcare ecosystem of patients, physicians, providers, and communities. When we, from CSIT, evaluate applications, we look not only at the idea that a company has, but we look at other factors, including what's their implementation plan, what's the community impact, what's the go-to-market strategy, what's the team of people that they have working on this. Because we want to be sure that we're backing ideas that are going to make it to the market and are going to have positive impact on maternal and infant health. I want to give you a quick overview of the awardee demographics. What was encouraging to CSIT about the awardees for this program was that many of these companies were new to CSIT. They had not received prior funding, so we were identifying new innovative companies that had not yet been brought into the CSIT and EDA family to be able to leverage capabilities that we had. And these are small companies. The majority of these companies have 5 or fewer employees. So these are really early stage, getting started companies. And we saw a real increase in the diversity of the awardees. 38% were self-reported as minority-owned businesses, and 33% were self-reported as women-owned businesses. Going forward, we anticipate that all of these companies will be able to benefit from additional CSIT and NJEDA grant and incentive programs as they continue on their commercialization journeys. I'd now like to introduce 2 of our awardees to tell you a little bit about the work that they're doing. I'd like to introduce Sonia Cicada from Vitruvia and Virgela Leodore from ANP Creative Studios to tell you about the work that they're doing. Sonia.
All right. Good afternoon, everyone. My name is Sonia Cicada. I'm co-founder and CEO of Vitruvier, a preclinical biotech based in Nutley, New Jersey. The problem we're addressing is the critical unmet need for safe and effective treatments for CMV, the #1 infection for causing birth defects in the United States. It disproportionately affects minorities, and it is transmitted through disadvantaged urban areas. CMV can cause pregnancy loss, and it's transmitted through breastfeeding, which is particularly dangerous for preterm babies that abound in these areas. The solution that we are proposing is a bispecific protein that targets non-mutating areas of the virus, as currently available treatments are very toxic, and they fail due to rapidly mutating capabilities of this virus. We're developing this drug as an oral agent, which is very important for safety for both mothers and infants, and for compliance and for ease of distribution. So access to grants such as the CSIT Maternal Fetal R&D grant are pivotal for us to develop the R&D that is necessary to move into human clinical trials. So we're very grateful. Thank you.
Good afternoon, everyone. My name is Virgella Lador, and I'm the Chief Operating Officer with A&MP Creative Studios. And we'd like to first and foremost start with acknowledging the vision, effort, and collaboration that brought the Maternal and Infant Research and Development Seed Grant into reality. As we look back at the onset of the pandemic, one thing our team at A&MP Creative Studios really had firsthand experience in is the power that private and public partnerships have in addressing pressing and persistent social issues. One of those reoccurring issues was the issue of equitable access to healthcare practitioners. As a private Black women-owned small business, our partnership within the nonprofit sector as well as institutional partners, including the New Jersey Black Women's Physicians Association and the Robert Wood Johnson Medical School Women's Health Institute, has allowed us to give birth to a digital app called TULIP, which stands for Technology Uniting Like-Minded Physicians and Patients. Our objective with TULIP is to improve the clinical racial competence of those caring for mothers and babies in our state of New Jersey, as well as providing racially congruent physicians to New Jersey residents. We are more than thrilled to be able to align our technology with the Nurture New Jersey Maternal and Infant Health Strategic Plan, and are extremely grateful for the valiant team of students who helped us bring this technology to fruition, and we're really excited to make the reality of New Jersey being one of the safest places to give birth and raise a baby our present truth. Thank you.
So congratulations again to all of our companies. Again, really looking forward to all of your great work. So that concludes our conference for today. I just want to thank First Lady Tammy Murphy for joining us and all of our amazing speakers. Thank you all for attending, and really have a great rest of the evening. Thank you, everyone. Yes. So if our companies could stick around and actually come to the front, we're just going to take a quick photo with all of our awardees.